The Lillian McDermott Show.
We love, we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough, and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be right here, right here. And when you need a friend, you can count on me. I'll be right here, waiting for
you. This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening and viewing friend. It's so nice we can meet each other on the air on this beautiful, best day ever. And for those of you who are tuning into the classroom for the first time, please know I've been waiting for you. This is a safe place where you can go to when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening and viewing friend, will feel empowered to embrace a new truth and live the life of your dream. Now, as you know, I love highlighting doctors that are beyond what they're doing. They're, the allopathic traditional things. Well, in comes Dr. Stephan Esser. And I met him when I was in Jacksonville doing radio, and I went to visit him. I wanted to meet him. And next thing you know, we met each other in other vegan events. And so not only is Dr. Esser board certified non-surgical orthopedic medical doctor, he also is whole food plant-based. And so that is a wonderful combination to have in a medical practitioner. Well, he is so passionate about optimal health that he educates his patients and how to achieve better consequences, outcomes from nutritional excellence. And Dr. Esser is here today because he's going to challenge us to a health reset. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Stephan Esser is here to do just that. Welcome back to the classroom, Dr. Esser.
Oh, it's my pleasure to be back and with all of your friends, joining them and being here to share that message.
Yes, yes. And so let's talk about a little bit about your background, because it's really rare to find a medical doctor who's board certified and orthopedics that is also passionate about nutrition. Usually they're about prescribing the pill. And I know that you are a champion at education when it comes to nutrition. So would you share a little bit about your background and how that passion got started?
Absolutely. I am a fourth generation plant-based eater. So
Wow.
my great grandfather actually in my family is who began this process of investigating where our health comes from. And as he began to read the writings in the late 1800s, early 1900s, he was like, wow, the reality is our health comes from healthy living, from the food that we eat, the exercise we get, the emotions that we carry, the sleep that we get, the toxins we're exposed to. And so he decided to radically change the life of his family. And that's what I want to challenge all of your friends, all of your viewers today, to say you might be making this change in your life, not for yourself, but for the generations after you, for your children, your grandchildren, your great-grandchildren, because the choices that you and I make are radically powerful, not only for our own personal health, as we know, also for animals' health and also for planetary health, but for our little social networks as well, very radically powerful. So my great-grandfather changed his whole way of living. And as a result, my grandfather, Dr. William Esser, founded Essers Ranch, right? Where for 65 years, he ran a fasting and health facility, over 30,000 patients, and coming to his 10-acre ranch in South Florida, where I grew up, getting to see the miracle of the body, the amazing ability of the body to heal itself when given the right tools. So how could I not be inspired to kind of try to carry on my grandfather's heritage? So I went off to medical school, the University of South Florida. I went to medical residency at Harvard. I did fellowships at Mayo Clinic. And then the last 10 years have been integrating sports medicine with lifestyle interventions, trying to get people to radically transform their health through their fingers, feet, and forks. And now I do a lot of stuff, both online, virtual stuff, as well as we now have a nice Essers ranch that's coming back. So we can take about 8 to 10 people at a time for a juicing and healthy living facility here in beautiful Ponte Vedra Beach, Florida, out near the beach. So excited to really bring people the best science, because that's what's so important your viewers recognize. This is not about feel good or hippy dippy or da. This is the best science that exists today in modern medicine. Says that the more plants that we eat and the more regularly we move our bodies and the more we manage our stress, the lower our risk of all the common diseases of heart disease and diabetes and breast cancer and prostate cancer and colon cancer, and the list goes on and on. So what we do are the greatest predictors of our personal health.
You know, I love your enthusiasm and I love your energy and the fact that 4 generations of whole food plant-based, that's remarkable. Now, I get emails, texts, notifications, comments all the time. And I don't know where this comes from, what kind of science they're reading, but they're saying that the raw vegan or vegan lifestyle is very unhealthy and that many of them get dementia and many of them get sick. What do you say to people that say those things? Do they have data? Because I've never seen any data like that. Although I know that there are nutrients and people that call themselves vegan, but they eat horribly. So can you share a little bit about those myths or facts? What would you like to say to those people?
Absolutely. So the data that exists is pretty much incontrovertible, that for the most common diseases, eating a plant-based diet radically reduces your risk of these diseases long-term. Kim Williams, the former president of the American College of Cardiology, made such a great quote where he said, there are vegan cardiologists and there are those who have not read the literature, right? Just straight up. This is the president of the American College of Cardiology, right? Now, so here's the reality. People like to hear good things about their bad habits. So if I tell you that, eating fruits and vegetables, steamed, let's say some steamed broccoli and, a little brown rice is going to keep you healthy, people ask where you got your medical degree, right? And all kinds of crazy questions. But if I tell you, you can eat all the meat and the fat and the butter and the lard you want, you'll be healthy, people celebrate and they say, yeah, sign me up. Because innately we want to be able to eat what we want to eat. And most of us as humans desire foods that are dopamine rich. So as a result, we reach for the animal-based foods and the processed foods that give us more dopamine. And as a result, we think that that is what we're intended for because we feel good in the moment. But feeling good in the moment does not equate with long-term health. So all of the long-term studies in which individuals consume animal-based foods in a high-protein, high-fat diet demonstrate higher rates of disease, death, and morbidity. This data, which is not even real data, suggesting that plant-based eaters have highest rates of dementia, will start there, is non-existent. That's some benchwork lab data that would suggest low levels of omega-3s may translate to blank. There are no large follow-up studies following people over consecutive decades, looking at their rates of dementia related to their consumption of food. They don't exist. So for people to suggest otherwise is lunacy and just hogwash. That's number one. Number two, with regards to there being a need for specific nutrients that vegans need to address, or especially raw food vegans, et cetera, 100% absolutely. Years ago, decades ago, hundreds of years ago, let's say, we used to eat unwashed fruits and vegetables. And as a result, we would get bacteria on them into our gut. And those bacteria would produce B12 for us. But we got tired of chronic diarrhea, pooping our pants all the time. And as a result, we said, we've got to wash our vegetables and our fruit. And what happened? We washed off the bacteria that would otherwise form B12. So if you're just eating fruits and vegetables and simple whole foods, you've got to get some B12. That doesn't mean eat the animal, because remember, where do our bovine friends, our pigs, our chickens, et cetera, get their B12? Yeah. They get it from the bacteria that eat off of the ground. Yeah. But again, many of them also die of diarrheal illnesses or have chronic malabsorption issues because of it. Mm-hmm. So the reality is we live in a time in which a little B12 pellet can easily be consumed by your mouth and take care of the needs that you have with regards to B12. Mm-hmm. So as you suggested too, being a whole food plant-based eater is not being a vegan. It happens to fall in that subcategory, but it is not being a vegan. You can eat French fries, diet soda, and Daiya cheese, pizza and be a vegan. That is not what you nor I are advocating.
No.
And that is not where the health data is. Very important. So being a vegan for the animals or for planetary health, those are beautiful, but they will not necessarily prolong your life or reduce your mortality risk. So if you want to do all three, well, then it's whole food, plant-based approach. That's what we need to be doing. At least 80% of the calories from minimally processed whole fruits and vegetables, bright, fresh, and raw, and the rest minimally cooked where and needed, etc.
Yeah. And I know all of you that tune in to the classroom and you're enrolled students and you're all excited. One of the things that is special about Dr. Esser that we discovered when we first met is that Dr. Joel Fuhrman went to his grandfather's ranch when he had his injury and he needed to rehab, and that's how he rehabilitated, and that changed his life too, Dr. Esser. So these four generations of whole food plant-based in your family have made a difference that have rippled beyond what we'll ever know. So, for those of you who love Dr. Joel Fuhrman, that he is Dr. Joel Fuhrman because of the Esser family. That's what I would say.
Well, and Dr. Shelton, who is also one of the contemporaries of my grandfather, and I think Dr. Fuhrman spent some time there too. So yes, powerful. And a reminder, like you said, to all of us that, what we do can radically change the future for so many other people. It's not just for our own personal health.
Yeah. And I had mentioned to you that, we have this raw vegan challenge that's going on, and we start that April 18th or started that on April 18th. And what I'm so excited about is Dr. Esser is going to be our teacher in May. So May 3rd, he will be joining us at 7 p.m. For those of you who've signed up for the Raw Vegan, May 3rd, you will have an opportunity to really get to know Dr. Esser and ask him questions as well. So when it comes to, you mentioned quickly, but I this is one of the things that I eat a lot of walnuts, and there's a lot of omega-3s and is it 3, 6, and 9 or but walnuts?
Yeah, it's 3, 6, and 9. Yeah.
Okay, so walnuts are really good, and many people think that you have to eat meat to get or fish to get your omega-3s. Can you elaborate on other ways that we can get omega-3s?
Oh, absolutely. The reality is that deep green vegetables, are a great source of EPA, the eicosapentaenoic acid, and that's converted to DHA. Although it's not as perfect, the conversion, as what we might see that the animal may have already done for us in its own flesh, the reality is you get that EPA just like the animal did, right? So where did the different animals get their omega-3s in their bloodstream? Well, they get it from the green vegetables they're consuming. This is why it's so important that we are eating large quantities of those greens, not tiny little amounts. So this pathetic little salads we see people eating, that is not a salad, right? That is a little garnish. We're talking about massive bowls, big amounts. We are largely herbivorous, and so we need to be consuming large quantities of those foods. The use of things like flax seeds or walnuts as sources of omega-3s are nice ways to supplement what we're receiving. And these are great additional supplements, if you will, right? Not as a primary calorie source. And especially for the person, let's say, who's wanting to lose weight aggressively, large quantities of the nuts and seeds are very calorically dense. So small quantities, 1 to 2 ounces per day, being conscientious and aware. And if the weight's going up, say, hey, what's going on here? Am I eating the whole bag of those California walnuts? Or am I just having a small handful that is most appropriate for my calorie density? And then once you're at that healthy weight, you usually don't have to worry as much about the consumption of a small handful of those. But they're a great addition, nice little source of some healthy fats for our overall health.
That's wonderful. So today we're talking about making a choice to do a health reset or resetting our health. There's a lot of people out there that don't know they could feel better naturally. For me, I quickly shared before we came on the air that I was challenged to go raw vegan for 30 days, but after 4 days of eating raw vegan, which was very difficult for me in the sense that I had my recipes, Spanish, Italian foods, and all those things that were so come natural. I had to figure out a different way, a more creative way to eat. And so those first couple weeks were the worst, when it came to eating for my husband, he was like, what are you giving me now? What are you giving me now? But eventually I became really good about making other things. But after 4 days of eating raw vegan, I felt really, really good. And it wasn't that I felt bad. I just didn't know I could feel better. And so I thought, if food can make me feel this good, what else have they lied to me about? That's what came to me at that moment. It was like this veil had been lifted. And then I started looking into water, nutrition, stress, and my whole life changed because of it. I started distancing myself as much of allopathic, which orthopedic is great. You put us together, you patch us together, but all the other doctors may be giving us managing symptoms with a pill. But I had the privilege of seeing you speak at a workshop and got to see how you motivate your patients to not just doing whatever exercise they needed to do, but to also challenge them to change their nutrition. So is that how you get them to reset their health? What are some of the steps that you do? How do you get people to be curious enough about changing their lifestyle to make a difference in their life?
Well, I think the first place when you start or consider a reset is self-awareness. I mean, that's the reality. When you just said, well, how do you get somebody to become curious or to care or think? Well, if we're so busy passively entertaining ourselves with the latest Tiger King Netflix show, it's very difficult for us to actually pause and be in a place of stillness and begin to get into a place of awareness, to be able to say, this isn't what I've always wanted. I'm not as healthy as I thought I could be. When you were, I often think about that as I see a patient, and we'll talk about this, when you were 12, is this the life that you wanted? You're 48, you're 59, you're 65. When you were 22, is this what you expected? And if the answer is no, well, then the next question is, well, do your behaviors have anything to do with that? And if they don't, if they have nothing to do with it at all, right? This person has maximized their nutrition, their sleep, their exercise, everything, and it's something else. Okay, it's something else. But for the overwhelming majority of us, the beauty is that there are opportunities for us to enhance our personal health. Whether this be the nutrition, whether it be the water, whether it be the sleep, whether it be the exercise, whether it be the emotional poise, whether it be the sunlight, whether it be the toxin exposures. There's 7 areas there. So even for me, for example, when my nutrition is just humming along beautifully, I might be staying up too late, working on PowerPoints, right? Doing talks, prepping things, whatever. Or perhaps when I'm sleeping really well, maybe I wasn't getting the right amount of exercise. So the beauty is in your life, there's always going to be something that you can modify. And when you're busy, let's say you've got 2 kids and working 2 jobs and blah, blah, blah. Oh my gosh. Well, it's still in your control is the apple that you can stick in your mouth or the orange that you can peel and stuff down your gullet. You may not be able to get to the gym or do the Pilates or the yoga class you wanted because of how crazy your life is. But do you have time to do 5 minutes of stretching on the floor before bedtime? Right? So we've got to make sure that we are not looking for perfection, but looking for excellence, right? Perfection doesn't exist. Excellence does. And achieving your most excellent health certainly does, because your most excellent health at 65 will not be the same as my most excellent health at 22. And that's okay, right? Because maybe I could run the 5-minute mile then, but at 68, I probably won't be able to statistically, but maybe I can run a 8-minute or a 7-minute, right? Or whatever it might be. We want to be the best and healthiest versions of ourselves today. This is the day, right? And tomorrow, a little healthier. That should be the goal. The best version of ourselves. So we shouldn't be comparing ourselves to others, but we should evaluate where we are ourselves. So number 1 is self-awareness. And so many of us today lack that. We're unwilling to go there. It's a scary place, right? It's a challenging place. But if we can get ourselves to go there, we can begin to evaluate, where do I have opportunity? Once you understand this is an opportunity, now you can begin to say, okay, what are my statistics? What are my numbers? What's my waist hip circumference? What's my weight? What's my blood pressure? What are my cholesterol levels? What is my energy level? How are my pain? How would I rate my pain in my joints? All this stuff. Before you know it, you begin to see opportunities. So I have patients all the time. I say, how's your health? Excellent. Then I look at their med list. They're on 8 medications. They've got chronic pain. They're coming in to get their steroid shots in their knees. I'm like, whoa, you and I need to talk about this definition of excellent, because many people have put themselves on the shelf too, haven't they? They've kind of given up. They're finding joy in dopamine-rich foods of addiction, right? All of these food-like substances of addiction, as I call them, all the processed foods, the white flour, white sugar, oils, meat, and dairy. And they're finding little hits of dopamine like a drug addict there, because they've lost sight of true joy, which the greatest joy, the greatest health, the greatest wealth is health, right? As the poet says. And that's the reality. So self-awareness, then knowing your numbers and statistics so you can test, not guess, right? So don't be living in make-believe. I mean, because I've even seen, quote, vegans living in make-believe world, right? As you and I briefly talked about earlier, you'll have this person who says, I'm a vegan, yet they're 80 pounds overweight, right? And a chronic high blood pressure and the blood sugars are elevated. That's not healthy. What are you talking about? So no, you're not where you need to be, but you need to look at those numbers so you can be honest and objectively evaluate your health. And, you know, go ahead.
No. Keep going.
So kind of self-awareness, know the numbers. The third thing that I would say is choose a path. Choose a path. You know, many of us are so busy just kind of ruminating, kind of in play. Oh, I'm going to do it one of these days. You know, when the kids grow up, it'll be perfect. Oh, when I finish this job project, then I'm going to get on top of this. Oh, when my mother dies because she's sick and I'm caring for her, she's in hospice. Oh, we all have these reasons that not to start on this journey. And the reality is, if you don't do it today, all that's going to happen is you're going to be older, right? So when you choose to start it in 5 days or 20 days or 2 years, you're just going to be older and you're probably going to be sicker because you've continued to abuse your body with toxins, etc. Yeah. So, you know, it's start on the journey. Don't wait for things to be perfect. Life will never be perfect for you. And when it feels like it's perfect, you're suddenly going to be older. And then you'll think, oh, I'm no longer perfect. Even though your life, you know, right? Because you said it was too busy with the kids. The kids are out of the house. Oh, and I had this job project. The job project's over. Oh, my mom, she's died. Oh, well, now I miss my mom. And oh, the kids aren't there. And I don't feel the support. And I'm kind of lonely. And oh, my goodness, right? So when I compare, I often say to people, you know, the reality is your cup, right, can be full with all kinds of chaos and craziness, etc. And the energy you're spending to wrestle with that and deal with it is a huge amount of energy. What if instead, if you just use this much energy to actually do something healthy for yourself? Instead of saying, I'm so busy, I don't have time to eat perfectly, why don't you just go eat a salad? Stop making a big deal about it. Eat a salad. And now the next meal, eat some fruit. And now the next meal, eat another salad, right? And it just one healthy decision after the next. You know, because it is kind of crazy when you think about this. The reality is right here. Here's the reality. If you and I just decided today, I'm going to only eat healthy food, exercise, go to bed at a reasonable hour, etc. And if we just did it, we'd be done.
Yes.
And the reality is we actually could do that. That's what's so crazy. It's like if you just did it, instead of thinking about all the reasons you can't, you're not able to, you're too lazy, too busy, too this, it's like, what are you doing? So I encourage people when they join my 4-week virtual program, we do a lot of talks about emotional intelligence and stuff, is to fly to the 30,000 foot view of their life and look down and say, how's it looking? And that's that self-awareness piece. Is my life orderly? Am I living a disciplined, healthy life? Am I becoming and living the personhood that I wanted to live? Am I as healthy and vital as I always hoped to be? And if not, well,
well, this is part of taking ownership and responsibility, which is what we talk about on the classroom. And, you know, and I want to go back because you've said so many things that I want to add. I want to have you elaborate on. You had talked about different ages. I'm going to be 59 years old. And it was Christiane Northrup said, don't ever give out your age. Don't ever say your age, because even though you feel good about your age, somebody else will put you in a box. And so what I need to say is I'm 33 years old with 300 years of wisdom. That's what I need to say. Okay. So with that in mind, we buy into the lie. So when at the age of 59, I expect to do as much that I want. If I want to do it, I want to do it. Now I know that there's certain limitations, but to me, it may not have to do with my age. Rather, it has to do with, body parts. Like, for example, my knees. Since I was a little girl, when I had to give up dancing, ballet, jazz, tap, modern ballet, because my knees don't have cartilage. My doctor said, you'll end up with a knee replacement. And I'm like, no, I'm not. So he told me to keep my muscles strong around my knees. So I will never need a knee replacement. But I am aware that, and my knees tell me when I've overdone it with dancing or overdone it. So there are certain things that I find that there is a bit of a limitation, but people have bought the lie that as you get older, you will get sicker, you will get fatter, you will get whatever. Oh, it's part of my DNA. We all know that it's not part of our DNA. What we inherit are the family recipes. We know that. So let's continue with, what would you say to somebody that has bought into the lie? Now, this has to do with self-awareness. We've bought into the lie that as you get older, you're just going to get more decrepit and lose your mind and fatter. I mean, what would you say to that?
I'd say two things. Number one is, none of us will be immortal, and that's not really our goal. I would argue, when I challenge patients, my goal is not for them to be immortal or, perfect with regards to their health. My goal is for them to be the most vital version of themselves at every age.
Love it.
And so, I remember so well my grandfather, right? 91, out playing tennis with me, kind of getting up in the mornings, doing his calisthenics and his morning prayers. And, so the reality is just what you said. The majority of people put themselves on the proverbial bench, 50s, 60s, and 70s. I love one of my grandfather's ads. It's still on my website, esserhealth.com. One of his little brochures. It says, men and women in your 50s and 60s don't go on the shelf, right? Because it was the reality that, what we often ascribe to aging is actually more related to disuse. Mm-hmm. So Walter Bortz is an MD out of Stanford who wrote all these books about thriving into your hundreds. And that's exactly what all his studies showed, was that when you put people in a bed, essentially forced immobilization, they get loss of muscle called sarcopenia. They get osteoporosis, loss of bone density. They get loss of range of motion of joints due to inflexibility of ligaments and fascia. And they get neurologic impairment where the nerves slow down their processing speeds. And so the reality is much of what we attribute to aging is secondary to disuse. And add to that a toxic nutrient intake that further corrupts the hard drive and further corrupts the system. So what we have, many of us, accepted as normal is not. A great example of this was the other day at a gentleman in clinic. January 2nd, I think is when I saw him. He was 81 years of age. He came to see me on multiple medications. He had chronic knee pain, chronic diabetic neuropathies, and his legs were largely swollen, secondary to both medication side effects and some congestive heart failure and kidney dysfunction. And so I said to him, give me 4 weeks of your life. And he's 81. He could have said, buddy, I'm 81. Right? Instead, he said, all right, let's do it. So I gave him a little 4-week detox that I guide people through. He went home and he did it. It's all fruits, veggies, beans, and rice, very simple approaches. And he did it for 4 weeks. He came back. He had lost 32 pounds in 4 weeks.
Wonderful.
His diabetic neuropathies were gone. His knees no longer hurt. His swollen legs, he was so proud. He's pulling his pant legs up. Look at my legs. I haven't seen legs like this. And his wife chimes in, you haven't seen legs like that for decades. I haven't seen this since you were 40, right? And they were just going on about his legs. It was awesome because all the excess fluid had, he had peed it off, gotten rid of it. His blood pressures, which had been in the 140s in the mornings, were now 110s. His blood sugars, which had been 150s, were now 90s in the morning. And he was off several medications. Wow. And he looked at me and he goes, I will never go back. I will never go back to how I ate. He goes, this is amazing. And what was the best part of it all, right? The best part of all, he said, I used to be a ranger on the golf course. I had to give it up because of my knees, and they had me just sitting up in the shop. He goes, I just talked to the boss. He said he'll put me back as a ranger because my knees don't hurt anymore.
Aw.
So,
Isn't that
and
beautiful? Isn't that
yes,
beautiful?
yes. And that is the reality, though, of this approach. It is allowing you to live your best life. I want to remind people, anyway, when I talk to them, my goal for you is not to be healthy. My goal for you is to be so healthy that you can live your best life. So the real goal is your best life. Your health is a foundation to allow you to live that best life. Because if you're not that healthy, you're spending all this time at the doctor. You're spending all this time taking drugs. You're spending your money on drugs. You're spending your time with stupid diseases that need not exist.
That's right. That's
The
right.
diseases of excess, the diseases of kings, type 2 diabetes, high blood pressure, heart disease, etc., need not exist for the majority of people the majority of time. And so this is so well proven. I mean, Nathan Pritikin with the Pritikin program, over 100 studies published in the peer-reviewed literature showing that 80% of people in 3 weeks can be off their blood pressure meds and off their oral diabetic meds with normal numbers. Over 100 studies published in the peer-reviewed literature, taking people and having them make a big change, like what you advocate, what I advocate in our programs, and they reverse their diseases. Done, end of story.
Yes.
This is published in JAMA and Diabetes Care and Cardiovascular, all the big articles, all the big journals. And yet we never learned it in medical school. That's the sad reality.
Yes.
So as a result, the patients never hear it, and the disease care system churns out more sickness, more illness, more amputations, more money for the hospitals. It is tragic. But that's why you're here. And that's why I'm here.
That's right.
To bring the best science and the best education directly to the people so they can make informed decisions to transform their lives.
What a beautiful story about the 81-year-old man. You tell him that I said, I want to meet him. I want to see him, because it's, we buy the lie that, okay, 81, you can't change. You can't teach an old dog new tricks. That is BS. That is absolutely BS.
Absolutely.
And I want all of you to know that this is what we do here as well. WhenYouNeedAFriend.com. I want to encourage you to go to WhenYouNeedAFriend.com. I also want to encourage you to accept the challenge, accept the 30-day raw vegan challenge. It's the start. And then you can go on to other things like Dr. Esser has every month. He has the 4-week detox, or it's a virtual program. You can do it from anywhere around the world. These are the things that we do that I talk about taking responsibility. If you were to take one word in the classroom, responsibility, but responsibility is not sexy. So I say living the life of your dreams, or living your optimal life, whatever it is that you want to add in there. But it's doable. It is so doable that only the addicted mind, the addicted mentality keeps us from that optimal health. It's the, oh, you can't do it. It's the lie. It's the lie. And so I want to encourage you to go to WhenYouNeedAFriend.com. But while you're there, make sure you subscribe so that you know, like right now, if you're a subscriber, you have all of Dr. Esser's information. You just go to his name, click it, and it takes you right to EsserHealth.com. And so check out also my social media while you're there, like and follow it, and check out my sponsors and do follow them or support them the way that they're supporting the classroom. I also want to encourage you to go to my Shop Now bag, because Dr. Esser and we talk about here as well that health is spirit, mind, and body. It's not just eat. If you eat, like Dr. Esser so beautifully said, that even if you're eating well, if you're not sleeping well, if you're burning the candle at both ends, if you're holding grudges, if you're not dealing with past traumas, or if you're not even aware that there is a higher power, those are little different things that can change your life. One of the things I want to encourage you is, and a very well-known vegan, Dr. Lorraine Day, who's a really good friend of mine. She and I did the New Truth series, Book of Revelation Bible study, and the 100 lessons from the Exodus. So you can get it online. You can get it also on DVD. It's a 12-week program. There's so many different things. The I Am the Solution workshop, that is a mind, body, spirit. We work on changing the mindset, working on increasing your connection to a higher power. And on the last day, we put it all together with the acronym SOLUTION. And I am the solution. The I am is the God in you. And so together you can do great things. And so there's so many different ways. There's many things in the Shop Now bag, and that will help expand, we'll give a percentage of the proceeds to the classroom. So check them out as well. Yeah, there's beauty products, for organic beauty products, all the way to ways to calm yourself down naturally. And so last but not least, you can become an enrolled student in the classroom. So you can donate $1 or $1,000, whatever, whatever you can. It will help, whether it's your time, your talent, your treasure. Please consider donating to the classroom as well. Today we have Dr. Stephan Esser. I met him in Jacksonville, Florida when my show was live on radio, and now he can come on anytime he would like, because it is so important that we take ownership for our life. And Dr. Esser can sit there and prescribe pills because that's what he was trained to do, pain management, medication management, whatever it is. But even at 81, he will not give up on you. So you can go to esserhealth.com and think about different ways that you can collectively, whether it's from my program or his program or any program that's out there that encourages you to think outside the box, step outside your comfort zones, try something new, even if you do it for 30 days so that you can monitor your health. Do it. And so Dr. Esser, I want to thank you for coming on here today, because, and also volunteering to be our teacher for the 30-day raw vegan challenge starting on April 18th. All the way through May 16th, which brings us into the 11th year of the classroom. So we're really excited about this and how we're going to enter our 11th year in the classroom, going back to the roots of where my life completely changed, which
Awesome.
was a simple raw vegan challenge. So
Love it.
Thank you, Dr. Esser. Now, I have a follow-up question for you, also in what you were talking. You were talking about the dopamine-rich foods, right? Which are the animal products, and you had referred to that as animal products and processed foods, and
That's right.
Yeah. So, are there any dopamine-rich plant-based foods?
Oh, thousands of them.
Okay.
The reality is, dopamine is this hormone that makes us feel good, pleasurable, safe, satisfied, etc., content.
Mm-hmm.
And the way we're created is such that we desire those foods. Because when we eat dopamine-rich foods, it means we're getting more calories. And that increased caloric consumption makes us more likely to survive through periods of famine. So it is very normal to desire higher calorie density foods. This is where some people make a mistake. They kind of beat themselves up saying, I've got this problem. I can't believe I want the cake or I want the donut. It's like, yeah, that's a pretty normal response, because that's a very calorie dense food. It's going to make you feel pleasurable. And that is a survival mechanism. Mm. The problem is, it would help you survive through periods of famine in the old days if you ate the calorie dense foods. In America today, there's no longer famine. There's just feast nonstop. And so we all have diseases of excess. Mm-hmm. Now, the reality is you can get beautiful quantities of dopamine that still taste good, feel good, etc., from plant-based foods. They're going to be those that tend to be more calorie dense, whether it be the nuts, the seeds, the nut butters, whether it be dried fruits, whether they be things even like beans, right, and rice. So that takes you to the calorie density model, where we see, right, that kind of vegetables are 100 calories per pound, fruits 300, we get rice and beans 500 to 600, so on and so forth, and nuts and seeds more like 2,000, if not more, per pound. And so as a result, when you consume the more calorie dense foods, on average, they will release more dopamine in the brain. And so, for example, taking, like I did this morning, we took some almonds and walnuts and a little bit of oats and some, I think a little hemp seed, put them in the food processor, ground them up, and then dropped some figs into there slowly and some dates and raisins, et cetera. And a little bit of, even put a little bit of date syrup, pure date syrup in it. And then it balled up beautifully into these nice little balls that we made. And my kid, well, those are great, but they're very calorically dense. So again, if your goals are weight loss, those are not ideal for you. But otherwise, they're a fun treat. When you're out exercising or hiking or just need a little snack, one of those with an apple would be beautiful. Mm-hmm. And that gives you a nice little release of dopamine. Again, my goal is not to have people living in a dark room eating organic kale all by itself. That, in isolation and sadness, we want to eat these foods like behind me even here, the oranges and the apples and the avocado. They give you beautiful amounts of dopamine. But for many people, if they've been accustomed to massive quantities of dopamine from food-like substances of addiction. Then when they go to eat the orange, they're like, I'm not getting much here. Not very exciting, right? So, but the reality is, once you've cleansed your palate with a beautiful 30-day program like you're offering, right? Or one of my virtual programs, now when you go to eat those simple foods, that medjool date, oh my goodness, right? that ripe pear, right? That's sweet and juicy, it melts in your mouth. That amazingly ripe mango coming up in July, right? Oh, so wonderful, right? That's what you're getting then, because you've reset the dopamine sensors. So very important, your sensors can be hijacked and then become so accustomed to this massive, rich solution that the simple foods don't taste as good. But as soon as you detoxify, now they taste amazing. And you begin to enjoy and appreciate the subtleties of the sweet juiciness of the apple, the saltiness of the celery, things like that, that you never really appreciated in the past. And that's the natural innate, flavors and quality of these foods. So yes, life and food should be a celebration, but we shouldn't buy the lie, remember, which is the marketing that the cute, sexy, fit people are all eating McDonald's and drinking alcohol. No, they're not. No, they're not. They do that briefly and then they all get fat, sick, and nearly dead. That's what happens. But the marketing has tried to convince us that to really have fun, you got to eat those food-like substances of addiction and get hammered all the time. That is not the truth. That gives you exactly the opposite over time. And we've all seen it. When we stop and think about our friends, how they looked in college or high school, and now how they look in their 30s, 40s, 50s, and 60s, we're like, oh, what's this all about? And only if you buy the other lie you mentioned, which is that people say that's normal, does it even make sense? Because you're like, oh, I guess this is just getting older. It's just getting older.
My mom has diabetes. My dad has diabetes.
That's right.
I guess I'm going to get diabetes.
Yep. And totally not true.
Not true. That's right.
Yeah.
That's right. Okay. So let's go back on track. What are other things that we can do to reset our health? You've talked about self-awareness, knowing our numbers and stats, and choosing our path.
Yeah. Once you've chosen that path, then it's crucial that you kind of reevaluate. And that's the next thing for resetting. You've got to reevaluate. I mean, if let's say you go into a business and the business is failing and it's really about to go bankrupt, and you're trying to revitalize this business, it's going to be crucial that you know everything about the business, the ins and outs of it, that you understand where all this spending is happening. You change the patterns, and then you reevaluate and modify, so that you have to be dynamic. This is crucial. You cannot get into ruts and habits and then never reevaluate. So every week, even every day, right? So there's, in the Christian tradition, you've got the Augustinian philosophy of kind of every evening, right? Spending this Ignatius kind of a reflection every night, where you kind of evaluate your day. How did you do? How did it go? What could you have improved on? How can you improve in holiness? Well, the same way for your health, that you could stop and pause and say, oh, there we go. I was at work. Jenna came in and started complaining about the boss and the stress. Before you knew it, we both headed to the lunchroom. And then we were eating the Krispy Kreme that Janet brought in. And there we go. This happens every Wednesday when I see them, blah, blah, blah. All right, well, what's the answer? The answer is A, avoid that person. 2, if you're going to talk to them, control the conversation so it doesn't go into that stress-inducing place. 3, have food at your desk that you could grab and stuff in your mouth so that it's too busy chewing up the carrot sticks, the celery, or the apple, that you don't have any room to stuff the Krispy Kreme donut in, right? So beginning to problem solve, yeah? And then channel factor your life. Yeah, such a great term, to channel factor your life. Yeah, a river flows a certain way because the channel guides it that way. And the channel may be made by the large mountain that blocks the route of the river, or by the valley that draws it downward, or by massive granite stones that redirect it. But any little, leaf litter, small branches, little stones, they'll just get carried right along if your river is strong enough. So the current has to be strong enough, but it can't be strong enough unless the channel is guiding it in that direction. If you're trying to go upstream all the time, that's going to be tough. So you've got to figure out how you can channel factor your way around that mountain, perhaps, with your life and move forward. So, for example, if every time you drive by the McDonald's on the corner of First and Hawthorne, you always go in and get fries, that's what you've always used to do with your son. He's now in college, but you still do it. It's kind of a love affair with him and a relationship, and it's all there. and you want to stop that because you want to lose the weight and get rid of your diabetes, you can't drive past First and Hawthorne. You might have to drive out to 10th and McClucken, right? And drive around there. That's the reality. So you've got to break the habit. You've got to change the channel in which you're going, right? If you want to start exercise and you know as soon as you get home from work, there's no way you're leaving the house, well, you've got to pack your clothing in a bag in your car the night before so that on the way home, it's there. And you've got to change your drive pattern. So you're going by the gym or by the running track at the local high school. Mm-hmm. So the reality, this is all doable, just like revitalizing that little business that's in the red. But you've got to be intelligent about it. Mm-hmm. You can't be an addict. You can't be undisciplined. You can't be, as you said, irresponsible, mm-hmm. because otherwise you will not bring the company back. So you've got to take on the perspective that you're the CEO. You're the CEO of your health. And you're the one in charge, right? Or the architect, if you prefer that. But you may need help. You may need assistance, and that's fine. You reach out to the resources, right? They've got you, they've got me, they've got hopefully other advocates in their life, people who support them, PTs, OTs, MDs, chiropractors, nutritionists, whatever it might be, life coaches, friends and family members. You've got to identify who supports you and lean hard in there. Use them. So if you're revitalizing that business, but you're not very good, you're not perfect at accounting, you better get a good accountant. Mm-hmm. And if you're not good at fixing the machinery in the warehouse, you better get a good person to fix that machinery, because they're either going to make or break you. And so, but there's no weakness in being the CEO and saying, I need some help. There's actually intelligence. Mm-hmm. So you don't have to go all this your own, right? That's the beauty of where we are in today's society. You've got real-time people, you've got virtual, situations. You've got so much to support you, but you've got to get out of the headspace of that. I'm a leaf and my life is so overwhelming and I just can't do it. And what are you talking about? Stop being a leaf. Instead, you say, my life is really challenging. Let's list the challenges. I've got the sick mother. I've got the abusive husband. I've got the challenging job. I've got the da-da-da. Okay, great. You are correct. You have a lot of challenges. Now, let's problem solve. How are we going to address each one of these to improve them? Will your husband go to counseling? Yes, no. Or do you need to separate, right? Is your mother, can other assistants, get home health care? Can you get, family members to take split time, right? The children, the this, the that, all of this stuff. It can be improved, but you've got to be aware of it. And you maybe have to be willing to change. And you've got to change your perception of yourself.
Absolutely.
Right? Because so many of us are still in that victim mindset.
And that releases dopamine too.
Yeah.
That victim mentality. So
right. And so we've got to get out of that headspace into the victor mindset. Right? It's not, woe is me, my life is so hard. It's, there's some serious challenges. I'm going to face these. How do I go about doing this? Totally different. That's not negating the fact that, forgive the French, your life sucks. Instead, it's right, because we could all, right? What did Milton say? The poet Milton, he said, the mind can make a heaven of hell or a hell of heaven.
Correct.
And
that's what we talk about in the workshop too. So yes, absolutely.
So powerful. So we've got to recognize, what are we thinking inside and internally? Be aware of those thoughts, but we've got to get back in the mindset of, I am the CEO, I'm the architect, right? And so in that mindset, in that, kind of sitting position, in that, we've got to start evaluating where we are, what our success looks like. Are we being successful? Yes, no, or maybe. And then make changes. Make changes accordingly. My health is not where it needs to be. I mean, I do this all the time where I'll be like, oh my gosh, I'm getting worn down. I've got some congestion built up and blah. And then I go, yeah, that's because you've been up every night till 10:30, 11, and you're getting up at 6 and you haven't been getting your exercise and I mean, right? And it's like, oh, okay, that's right. I need to start sleeping for a couple nights in a row. Okay, there we go. Now I feel better.
Yeah. Isn't total self-honesty, isn't it a gift? It really is a gift. And, it's like, we know it's happening, but we don't even look our direction. What we do is we go for the distraction. What is somebody else doing? It's the speck in somebody else's eye, but the plank is in mine. It's like, all these distractions keep us from doing that self-reflection, that evaluation. And I love what you say about setting yourself up for success. To me, if I am going to go work out in the morning, if I don't take out my clothes the night before, my intention is not to go.
That's
And
it.
so I always, when I'm coaching somebody, I'll say, okay, based on your results, what was your intention? Because if you didn't do it, then your intention was not to do it. Because if
That's
you
right.
really want to do it, you'll do it.
Yeah.
And so it's you got to work backwards. You got
Yeah.
to work backwards. And so the other thing that you had mentioned is well, you talked about the making the plan and changing and going with the knowing that if this is something that's really difficult for you, to claim it, to say it out loud and create a plan for whatever. If you're upset with your current situation with your spouse, you either accept it, embrace it, try to work together with it, or walk away. Those are our choices. But people make decisions fear-based. And so what would you say to someone who is so full of fear for taking that step that's going to lead them to optimal health?
Take our hand, walk forward, and let's do this.
I love that.
Yeah.
I love that.
You can do this. You are worth it. You are worthy of health. And what you do matters. You are powerful. Get your power back, right?
Yeah.
Yeah.
Well, it's funny because, when you say you're powerful, like I say, I believe in you, I believe in all these, but we ourselves have these limiting beliefs about ourselves that we just can't do it, that we just can't do it. It is very important that we say to ourselves those affirmations and rewrite the program of the lie. Rewrite the program of the lie.
Yeah, and there's a thing in psychology talking about the dead wood, right? Cutting off the dead wood off the tree. And boy, can that be painful sometimes. Because for many of us, the reality is for us to be healthy long-term, we may have to change who we are. I had to do this. So growing up in the wonderful family I did, right, there was still this like, ooh, well, if I'm told not to eat that, maybe I really want that, right? Which we all go through that, and that adolescent rebellion and that desire. And I had to come to that place of saying, no, actually, that's not the person I want to be, right? Sometime in my mid-20s, actually, when I was in medical school, I came to that kind of conclusion. I no longer want to be the person that's like, oh, I really want it. Oh, but I know I shouldn't. Oh, but I want it. Oh, I'm going to sneak it. Oh, what are you doing? Like, I no longer wanted to be that person. But you know what it required me to do was to demonstrate discipline again and again and again, until that became my new reality, the new me. And once it became the new me, it was like, okay, yeah, this is me. And I'm okay with that. And I feel pretty good about that, So it's fascinating to think about. But yeah, we may need to cut off dead wood. You may have to be a new person. And if you've been that person who's always just complained about everything, oh, the water is too hot, the water is too cold, the vegetables are too fibrous, the this, the that, oh my God. Well, you may have to change that. And guess what? You can start tomorrow. You can start right now and say, I'm no longer going to complain about unnecessary things, right? Because they're a waste of time and a waste of energy. And you could do that. You could actually do it right now and not only spend your time and energy on things that are really valuable, worthwhile, and that really should take your time, energy, and passion. Imagine what life would look like if you did that. Yeah. It's kind of crazy to think about.
I know. And once you go beyond what your limitations are, you realize there's a whole new world that we have been kept from.
Yeah.
And it's not that they're keeping us from it. It's that we don't even aspire to go there because we don't even know that we can achieve it. And so we sit in that comfort. And as I said, comfort is of the ego. There are four things that you're in your ego. You want to look good, you want to be right, you want to be comfortable, or you want to, there's a fourth one there somewhere, but and in control.
Those are good.
But comfortable and the ego can kill you. It can kill you, because there's people that are comfortable being beaten every night. There are people
Right.
who are comfortable drinking a pint of whatever alcohol
Mhm.
every night, or numbing out until they pass out. Comfort can kill us. And so what
Yeah.
I'm hearing you say, Dr. Esser, that it is so important that we become real and true with ourselves and stop focusing on anybody else to try to fix them so that we don't have to change.
Right.
Because if I fix you the way I think you should be fixed, I don't have to change.
Right.
So it's that reality that we all get to have. And so, okay. So another thing I wanted to ask you, Dr. Esser, is you were talking about the mentality, the mindset. And can you share and elaborate a little bit about foods and how they're designed to trap us through addiction as well?
Yeah. So once you consume these food-like substances of addiction, I won't even call them true foods. Yeah.
I love it.
These food-like substances, these foods release massive quantities of dopamine. And most of these foods are very complex. For example, they will have, they're multi-experiential. So to give you an example, let's break down, for example, Dairy Queen sundae, let's say, right? So it's got the cold of the ice cream with excessive quantities of sweet in it. Because remember, when something's really cold, it requires much more sugar to taste sweet than if something's hot. That's why, if you've ever noticed, if you melt your ice cream and eat it like hot, it's like, whoa, this is like super sweet. Even if it's like a vegan ice cream or something. It's because the cold offsets the sugar receptors. So you have to add that much more sweetness to really trigger a sweet experience. And so you've got the cold, you've got the sweet, and many ice creams also add salt, because the salt triggers a desire for consumption, right? And causes overeating, which makes you buy more product. And then this sundae, what do they add to it? They add kind of hot, right? Some chocolate topping that's hot. Oh boy. Yeah. And then maybe we put some pralines on there that are crunchy. So now you've got, and then some whipped cream, which is really smooth. So you've got the smooth fluffiness of the whipped cream. You got the crunchiness of the pralines. You got the sweet and the salt. You got the hot and the cold. So there's this absolutely unnatural explosion of different experiences in the mouth, and each one of them by themselves. So let's say you had a spoonful of peanut butter. Let's say you had a handful of nuts. Let's say a little bit of dark chocolate. Let's say you had a cup of cold almond milk. All of these will, in and of themselves, give you some level of dopamine. But now if you mix it all together, it's like 3 orgasms, right? This I
want what she's having.
Right. An explosive release in the body and the mind. And the problem is, we then have this imprinted neurologically to the time, the place, and the experience. So if, as a child, let's say you grew up and every time your grandmother brought you home from school, she brought you to Dairy Queen. Well, now you affiliate the warmth, the touch, the love, the sensitivity, the safety of your grandmother with that, without realizing it, because it's imprinted in the brain.
Correct.
So all the parties, all the gatherings in which your family bought you the double cheese Domino's pizza with cheese in the crust, you have this interrelationship now with it, emotionally, psychologically, and hormonally. Because these foods result in the release of different forms of hormones within our bodies, pleasure hormones, satisfaction hormones, etc. So crucial, right, that you recognize this. So the way I was raised, as a 4th generation plant-based guy, well, when I have, for example, frozen banana ice cream where you just blend it in the Cuisinart or put it through the Champion juicer, I associate that taste with parties, with gatherings, right? Or when I take a medjool date and stuff with a little peanut butter, right, and eat it, I associate that with the same pleasurable type experiences that the person does with their sundae. So it's very important you and I recognize we've been wired over time. We've been programmed. Not all of it is some sort of weird conspiracy theory. It's purely that the things that you've eaten and consumed in this certain experiences have now, by your brain, been associated and affiliated and wired down. The more you did it, the heavier the wiring. Just like if you walk in the woods, first time you walk through, you're like pushing branches apart, and all this sort of stuff. Well, if you walk that exact same path year after year, you can make it into a 6-lane superhighway with asphalt, right? And 2 feet deep. And so how we talk to ourselves, how we perceive ourselves, all that is based much of it is around, of course, our cultural relationship with food, our social relationship with food. And so important to just be aware of how are you programmed? How are you right? I had to deprogram myself from the media I'd see that said, oh, having the pizzas, the young, sexy people. Oh, drinking the beer will make you feel like more of a man, right? Eating the roast beef will make you more manly, et cetera. Even though I never believed it, et cetera, it was still, I saw it in our culture day in and day out. So there was some level of that I had to be like, what? No, well, no, actually, if you're eating all that roast beef all the time, you have less of an erection. So you're probably not more of a man as far as in the bedroom. And as far as the alcohol, it just makes you stupid and do things that are dangerous and higher risk of, all kinds of badness, right? And so it was like, no, you have to deprogram it and break it down. So food is information at the cellular level. It's crucial your people understand this, right? This is not just calories in, calories out. When you consume food, it actually has a physiologic effect at the receptor levels on your cells. So you consume that fiber. It gets absorbed through the villi and the microvilli in your intestinal tract. It gets brought into your bloodstream, all the little elements of the fiber. This circulates, it binds to your receptors of your muscle, of your bone, of your skin. And it tells your cells to either A, increase inflammation, B, reduce inflammation, A, increase multiplication, B, decrease multiplication, C, the list goes on. So, whatever that cell does, the food that you eat tells it to do more of or less of certain things. Dean Ornish did such a great study with that, right? Where he followed people with prostate cancer and followed them over multiple years and showed that by eating his heart disease program, they would turn on or turn off genes. They would radically change the expression of the genes of their body at the cellular level, a phenomenon we call epigenetics, right? You don't change your genes, you change how you express them. And what we want to do is express our genes in the most flourishing, vital, healthy way possible. And that is what the food does. So every time you eat, next time you have a meal, remember me. And remember that it's like, oh, what do I want to tell my body right now? Do I want it to be more disease-ridden, more inflamed, or less? Well, you get to make a choice with your fingers, forks, and spoons.
We could probably talk for 3 or 4 hours. I align myself with your message, and I would love to see more of you in the classroom. It is so important that not only that we listen, but we do our research too, because for every Dr. Esser that is out there, for every Lillian McDermott that is out there, there are a million who try to teach you otherwise. They, from the moment you're conceived, the moment you are born, the moment that, that the system takes you, it's programming you to enter disease at a very early age. So just know that you can take your health back and change the outcome of your life and do that reset. Because one of the things I noticed, Dr. Esser, is I used to be a sugar junkie. And when I started eating raw vegan and I started changing the way I was eating, I didn't crave. I stopped craving all the sugars. I stopped craving all the foods that I thought, well, psychologically made me feel home and safe and all of that. What do you say to someone who's just now tuning in and thinks that, I can't do anything about that. I'll always eat this. I could never do it. I can't give up my sugary stuff or my meaty meats and all that. What would you say to them? Or fried foods?
Yeah, you can do it. It is worth it. And what you do matters. And there are millions of people over the last decades who have done exactly that and reversed their diseases, improved their health, and been able to experience the most vital health that they've had in decades. So, and the other thing I always say is, what do you have to lose? Give us 30 days of your life. See what happens. See how you feel and move forward from there. Don't join a cult. Just begin a healthy behavior and see what happens for yourself. And yes, the reality is you will change where your likes and dislikes are. Your habits can be changed. Your disease rates can be changed. All of this through the choices you make. And it's so much fun. And it's so gratifying to do because you're the one who's going to be doing it. And so all of the sort of joy and all of the, kind of honors go to you because you're the one who's doing it. We're here to educate, guide, encourage, and motivate. But you're the one who can radically transform your health.
Very good. Very good. Really quick. Any recipes that you would like to share for people that are, preparing to do the raw vegan? And are there any recipes that you would say, or is there any channel or do we look for them and on Instagram or Facebook?
So on Instagram or Facebook, I'm at Esser Health, and I put up what I eat pretty much every day, so you can always take a look at it.
It's always very funny.
That's it. And but the reality is there are millions, literally, of recipes and things you can do with food. So what I'd encourage people to do is identify 5 or 10 different fruits and vegetables they enjoy, and then look up and different recipes and ideas with them. There's so many resources out there these days, and thrive and enjoy them because it's just fun to do, right? Start with simple things like, hey, I know I always love berries. Great. Treat yourself to a pint of berries and eat them, right? Or, I do like the taste of, jicama on my salad, or, whatever it might be. All right, we'll get some, slice it up and throw it on there, right? Treat yourself when you're eating these simple foods and celebrate, kind of. But yeah, there's so many amazing recipes and combinations. I don't even know where to start. It's just
well,
nonstop.
Hopefully you'll share them on May 3rd when you join us for our class for the Raw Vegan Challenge. Thank you so much, Dr. Esser, for being in the classroom today. I'm looking forward to seeing you on May 3rd. You can always find Dr. Esser on esserhealth.com. He's also on Instagram and Facebook at Esser Health. And check him out. Check out his videos that he does, shares all his pictures of his food, and get inspired. Maybe tune into his 4-week virtual program as well. Thank you so much, Dr. Esser, for everything that you're doing to empower people so that they can live optimal health. Thank you.
My pleasure.
And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. Stephan Esser wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.